We've got this traditional model, a way in which we've always worked, which is very much relied upon diagnosing and treating and discharging patients and very hospital based. But actually what we're seeing now is an increasing number of elderly people with long-term conditions, and the aim for these patients is often to keep them as well as possible and independent in their own homes for as long as possible. And if we continue to work in the way we've traditionally worked, we are never going to do that. That will be an impossible ask. And the reason for that is that demand is continually outstripping our ability to deliver care. We also have to recognise that unless we take a different approach to preventing ill health and to enabling people to manage their own long-term conditions, we are never going to keep up with demand. And one of the solutions to that problem is to integrate care, so that instead of all of our organisations working in isolation, we bring them together, we integrate things so that we deliver services more clinically effectively but also cost effectively. And so this is about making people healthier, influencing the lifestyle factors that lead to ill health. So whether that's smoking, it's obesity, it's alcohol, it's substance misuse. We have a high incidence of mental ill health. We need to develop resilient communities who understand their health, who know what to do to keep themselves healthy, and who also know how to manage long-term conditions, things like diabetes and asthma and chronic pulmonary disease, once they've got them. So we're developing networks of primary care practices and community services within neighbourhoods, working with community groups, the voluntary sector and the community in those places to really empower people to help look after themselves, help keep themselves well, and to give people other options rather than just traditional health services when things go wrong.